Hi, everybody. We're here in our lab, and we wanted to show you one of the phases of our process. This is actually a purification system, and this purification system allows you to extract the RNA from the virus that we can then further analyze in a PCR machine. So, by the way, I want to introduce you to my dear friend and colleague and partner, Dr. Zhang, who is the CEO of this company. We are going to do something really big this coming Monday for California, and we just wanted to make sure that you get a tour of everything that we can do. As you can see, we're not playing around here. We have the real equipment here. We're going to take you on a tour of our other systems, and with that, thank you very much for this time. We'll show you more video. So again, we're showing you some of the machines that we have, which demonstrates our capacity and capability to deliver on our promise in trying to solve this coronavirus problem. This machine is an ultra high capacity machine that can process, again, in the hundreds of specimens.
Each time, so each day if we do full run, we can run a few thousands with few machines. So very efficient.
Okay.
And that's why problem with CDC is after a few weeks they only testing 500. That causes problems. That if you're using an automation machine, each day you can test a few thousands without much issues. The bottlenecks actually is the purification steps. And PCR is simple. There are many systems already very high capacities.
Okay.
Yeah. We are a epigenetic company, so epigenetic is something beyond genetics. So epigenetic control genetics. So these we have many of these type of machines working with Illumina closely. We sequence human genomes, epigenomes, figure out your aging, cancer. So these are general research machines we're using, and very important parts of the transformation of we call the next gen sequence machines.
Yeah.
Yeah.
So again, another thing to point out is we also do in our work, we do a lot of genetic testing. These particular machines here made by Illumina are the state of the art in sequencing. Super high capacity, super accurate, and all of this, we're going to put this all to work in trying to solve this dangerous scourge of the coronavirus. And as you can see from these videos that the doctor and I are doing, we're going to do this in the most transparent way possible. We're not going to hide anything. We're going to show you the techniques that we use. We're going to show you the materials that we use. And we're going to work together with the world, with everybody, in order to go and defeat this virus.
These are standard machines in many labs that for PCR. There's a few major supply like BioRand, ABI. We also have the Roche, but not shown here. So these are 96-well format. Each run, we can run in 96-well samples, each small machine.
Yeah.
Very fast, very efficient. So like we just need just a couple hours you can run. If you run in 5 or 10 times each day, we already running whole CDC's 500 samples, just one machine.
Yeah. So.
So these are all different capacities machine, real-time PCR. Plus our design, our assay would be single wear, not like CDC, 4 wears. So the single wear we can do a complete assays with high efficiency and specificities.
Excellent.
And the CDC need 4 wears to do one samples. Cause problems.
So one of the things for those of you out there trying to figure out what these machines are, as the professor already explained to you, these are in fact PCR machines. These, by the way, are our small machines. These small machines, just to repeat what the good professor said, we can process 96 on each of these machines. 96. In one day, if we ran this in 8 hours, you do your math. We will run around 800. One machine. We want to show you how easy it is to actually do collection. This is not an extremely difficult thing. Obviously, in the real world, you would be doing things in a lot more controlled and safe manner. But the process itself is fairly simple. You have this vial that contains our secret sauce. Our secret sauce does a couple of things, by the way. First of all, it inactivates the virus, meaning it is not deadly anymore. But the other thing that's very important in what this does is it preserves the RNA of the virus so that we can analyze it in our PCR machines. Now, right now, I recruited a volunteer over here to go and demonstrate how to use this. And how about that? Mark, could you demonstrate how this is used?
Yeah, I'd be happy to. Thank you, Yobie. So first thing is you open the cap to the device. Secondly, by taking the provided swab, I open it and with my fingertips, careful not to touch the swab end, I remove the swab, open my mouth, about 5 times at the back of the throat against the tonsils, removing the sample and again putting it into the swab collection tube, breaking the swab, capping the tube, and I'm ready to send.
And this now goes to our lab, and in that lab, as I may have mentioned before, we go through a 2-step process. We go through a purification process, and after that purification process, we go to the PCR process, after which we can definitively and 100% say you have corona or you don't have corona. The way we've designed this entire protocol is we didn't want to be the monopoly for this process. We realize we have a global problem, and this is designed, in fact, so that any lab in the world that has PCR capabilities can actually go and conduct the actual analysis and provide the results. The net of net that we truly believe why we're doing this is that by knowing who is sick, we will get the ability to get people to self-quarantine. We would get the ability to figure out who is safe and who can continue to stay safe. The other thing too is that we can identify people who will not become human bioterror weapons, because that's what they are if they're sick and they're walking around. So again, we really believe that this is a global problem. We've designed this system so that it works not only in our lab, but in all the labs in the world that can do PCR. So, ladies and gentlemen, what I'm going to do today is I'm going to demonstrate to you how home collection looks like. It's not as scary as you think. We provide a home collection kit, basically this set of tools. This is a home collection kit. In the home collection kit, you will find 2 things. First, a swab, a very specialized swab, and the secret sauce that we have, which is the preservative that allows us to kill the virus, and that's very important. You don't want live viruses. In this tube, what we have in this tube is a solution that kills the virus, and renders it inactive and not dangerous, but it keeps the RNA of the virus so that we can analyze it. We want to also show you that we're not just an ordinary company. We are deeply committed to serving our fellow man and woman in our work. As you can see, our vision is clearly posted in every part of our company, to have a positive impact in the biomedical field and to contribute to the greater good of humanity.
Yes.